When shopping for health insurance, you'll notice there are a few different types of managed care plans, each with pros and cons. Let's talk about the difference between two kinds of plans: PPO, or Preferred Provider Organization plans, and HMO, or Health Maintenance Organization plans. All PPO and HMO plans have networks, the providers and facilities your plan is contracted with to provide healthcare services. The main differences between PPO plans and HMO plans are how you access that network and how the cost of care is covered. PPO plans give you more flexibility in which providers you see. You'll receive the highest level of benefits when you visit an in-network provider. You're also free to visit out-of-network providers, but will likely pay more out of pocket. HMO plans require you to stay within their network for care unless it's a medical emergency. If you choose to visit a provider who isn't in the network for a non-emergency service, there is no coverage at all, and you will be responsible for the entire medical bill. When choosing between a PPO plan and an HMO plan, consider what matters most to you: cost or flexibility and access. PPO plans offer more flexibility and might be a good choice if there's a healthcare provider you prefer to see. PPO plans often have higher monthly premiums and higher out-of-pocket costs, including deductibles. HMO plans might be a good choice if you're on a budget and don't anticipate many visits to your provider. They offer less flexibility, but often have lower monthly premiums and lower out-of-pocket costs. WPS is here to help. Visit WPShealth.com/explains to learn more about the ins and outs of health insurance.